Which of the following? Good evening, doctors. Let us do fast revision. Which of the following is the most common extraglandular manifestation of primary Sjogren's syndrome? A. Arthralgia, arthritis. B. Lymphoma. C. Peripheral neuropathy. D. Raynaud's phenomenon. The correct option here is arthralgia, arthritis. Which of the following clinical findings excludes the diagnosis of polymyositis? A. Neck muscle involvement. B. Extraocular muscle involvement. C. Dysphagia. D. Abdominal muscle involvement. Correct option here is B. Extraocular muscle involvement. This excludes the diagnosis of polymyositis. Which of the following condition is associated with normal anion gap metabolic acidosis? A. Cholera. B. Starvation. C. Lactic acidosis. D. Ethylene glycol poisoning. The correct option here is cholera. All of the following are neurological channelopathies. A. Episodic ataxia type 1. B. Spinocerebellar ataxia type 1. C. Familial hemiplegic migraine. D. Hypokalemic periodic paralysis. The correct option here is B. Spinocerebellar ataxia type 1. Spinocerebellar ataxia type 1 is not a neurological channelopathy. Most common identifiable cause of dilated cardiomyopathy is A. Alcoholism. B. Viral infection. C. Myocardial ischemia. D. Myocarditis. The correct option here is myocardial ischemia. Diagnostic feature in rheumatic heart disease is A. Aschoff nodule. B. McCallum's patch. C. Adenocarcinoma. D. Alveolar cell carcinoma. The correct option here is A. Aschoff nodule. A student unable to deliver speech before audience is suffering from A. Social phobia. B. Obsessive compulsive disease. C. Disorder. C. Agoraphobia. D. Claustrophobia. The correct option here is A. Social phobia. Chronic lymphocytic leukemia is associated with individuals more than 50 years of age. B. Mature small lymphocytes in peripheral smear. C. Hepatosplenomegaly and lymphadenopathy. D. All of the above. The correct option here is D. All of the above. Which of the following can cause delirium? A. Hypoxia. B. Barbiturates. C. Alcohol withdrawal. D. All of the above. Correct option here is D. All of the above. In Marfan syndrome, aortic aneurysm occurs most commonly in A. Ascending aorta. B. Descending aorta. C. Abdominal aorta. D. Arch of aorta. The correct option here is A. Ascending aorta. A patient has right upper limb BP of 180 by 95 mm of mercury and left upper limb BP of 130 by 9. He also has early diastolic murmur in right second intercostal space. Which of the following would be least likely associated with these findings? Correlation of aorta. Aspirin sensitive asthma is associated with which of the following? It is nasal polyp. Infertility in Cartagena syndrome is due to asthenozoospermia. Sleep apnea is defined as temporary pausing lasting at least 10 seconds. A boy is suffering from acute pyelonephritis. The most specific investigation is histopathological examination. 12-year-old boy presented with gross hematuria with 80% dysmorphic RBC 2 days after an attack of upper respiratory tract infection. Diagnosis is IgA nephropathy. Which of the following is not a feature of extramedullary tumor? A. Early corticospinal signs and paralysis. B. Root pain or midline back pain. C. Abnormal CSF. D. Sacral sparing. Correct option here is D. Sacral sparing. Treatment of choice of Kawasaki diseases, we all know it is IV immunoglobulin. A. Borderline personality disorder is A. Chronic feeling of emptiness. B. Unstable interpersonal relationship. C. Grandiosity. D. Lower self-esteem. It is unstable interpersonal relationship. Indication for ECT are all. Severe depression with suicidal risk, B. Catatonic schizophrenia, C. Severe psychosis, D. Severe manic attack. The correct option here is A. Severe. Which of the following is the most specific test for rheumatoid arthritis? It is anti-CCP antibody. True about tumor lysis syndrome are all except hypercalcemia. The gold standard for diagnosis of insulinoma is plasma 72-hour fast test. Urine analysis of patient with hematuria and hypercalciuria likely to reveal A. Isomorphic RBC, B. RBC cast. Correct option here is isomorphic RBC. Most specific sign of metabolic encephalopathy is A. Asterixis, B. Abulia, C. Akinetic mutism, D. Apraxia. Correct option here is A. Asterixis.